Good afternoon, everyone, and welcome to today's webinar hosted by Laboratory Economics. The topic for today's webinar is An Insider's Guide to Getting Your Lab's Claims Paid, Addressing Key Stress Factors. So at this time, I will turn over today's call to our moderator, Dennis Wiseman. Dennis, the floor is yours.
Well, thanks very much, Nikki, and I want to welcome everyone to today's national webinar. And again, our program is sponsored by Laboratory Economics, and I'm Dennis Weissman, once again, president of Dennis Weissman Associates, and I'll be kind of taking us through the course of today's program. Joining me today are two highly respected industry experts who have amazing backgrounds in both clinical laboratory operations and revenue cycle management. Tom Hirsch has had extensive experience in the management and operations of both hospital and independent laboratories. He is currently president and co-founder of Laboratory Billing Solutions, a leading revenue cycle company for diagnostic laboratories here in the United States. And prior to LBS, Tom was president and chief executive officer of Path Labs, Inc., at that point, the second largest laboratory in New England. Our second speaker is Kurt Mathis. Kurt is a thought leader in laboratory revenue cycle reengineering with more than 26 years of experience in laboratory operations. Kurt is currently vice president for Telcor Inc., which provides software solutions for point-of-care testing and laboratory revenue cycle management. Also with us is John David Klipp, founder and publisher of Laboratory Economics. Now let's quickly go over a very few housekeeping items, and I know Nikki started us out, but I just want to remind everyone that today's program will run for about 75 minutes. And by the way, we're setting aside plenty of time to get your questions answered following our speakers' presentations. Our webinar coordinator, Nikki, by the way, will be back again later after our presentations to remind everyone about the format that we're going to be using for asking questions. Finally, the webinar will be available for rebroadcast, and you'll be receiving an email within the next day or so with full information about this. By the way, and even though you can get a PDF right now, you'll also have another PDF coming with that message that's going to contain the presentation slides. Now, real briefly, laboratories are faced with an enormous and almost an endless list of burdensome reimbursement requirements and policies. And both clinical and anatomic pathology laboratories can't be blamed for believing that both public and private payers alike, it almost seems like they're ganging up on them. Led by the second year of Medicare cuts required by PAMA, and most recently by the rollout of Anthem Blue Cross Blue Shield's rate alignment strategy, which portends major cuts for lab and AP services for certain geographic areas, clinical labs and AP groups of all sizes are struggling to get adequate payment for their claims. And that's the imperative behind today's webinar program, namely gaining some expert advice, important insights, and practical tips on navigating the myriad complex requirements for getting your laboratory's claims paid, as well as collecting from patients with copay and deductible responsibilities. Now, without any further ado, let's get started. It's my pleasure to turn over the program to Kurt Mathis. Kurt?
Thank you, Dennis. I appreciate the introduction. This is Kurt Mathis. I'm Vice President of Reengineering and Service for Telcor. Telcor is located in Lincoln, Nebraska. Our lab customers really provide a wide range of services across the spectrum. Everything from anatomic and clinical pathology labs and molecular pathology, genetics, a lot of labs doing proprietary testing, tox labs, nursing home services, mobile radiology, sleep labs. We have quite a bit of experience across the industry. Those labs are facing the same industry struggles that the folks on today's call are, and we'll be addressing those issues today. I'd like to say thanks to everybody that is attending today from both Tom and I. we really look forward to sharing our insights with the group. It's imperative that you be considering the impact to your bottom line. It doesn't matter how great the services you provide are if you don't have a smart, nimble strategy in place to collect every dollar possible for those services. To stay profitable, you have to get paid. It's not that margins were never important, but labs need to make sure that they're watching their margins now more than ever due to all the negative reimbursement pressure present in our industry today. It's time to take a look at your revenue cycle. It's time to develop strategies that drive your collections, minimize your costs while doing so. When you execute well on your billing, labs can positively impact their revenue by double digits or more. For today's webinar, we do have a few learning objectives. First and foremost, understanding how to manage and measure claim errors to reduce denials, decrease your time to payment. Understand what those barriers to reimbursement and the strategies for navigating them are. Using smart tactics to strategically manage your accounts receivable. And practical solutions to working with your payers and your patients to maximize the cash you bring in the door. To lead off, let's focus on taking control and navigating requirements. The issues and impacts should hopefully be common knowledge to everybody on the call today. However, in case there aren't, we're going to cover each one of these. Missing information typically means you don't have adequate billing information. You don't have supporting documentation. You don't have authorization for services you provided. It could be that you don't have a member ID or you have bad insurance information or any other number of criteria. Patient coverage relates to the benefits covered by your patient's insurance plan and their liability. Your contractual arrangement with a payer or lack thereof may or may not be a problem. We're going to talk about that in a little bit more detail. And the requirements that must be met for claim submission are really sometimes like shifting sand, ranging from med record requirements, authorization for services, other specific data that must be included on a printed claim or in a claim file. I think Dennis said this at the leadoff. It's as if the groups are conspiring to determine how not to pay the claims. So major impacts are listed here, but they're not really just limited to this subset of 4. But we're going to cover these 4 extensively here. You know, any cause that delays claim submission or a claim submission that's incomplete based upon what that payer requires to have on the claim, it extends your time to payment. You know, if you're not in network with the payer, you're going to receive low pay. You're going to receive no pay responses. There may be the situation where they've cut a check to the patient, the paid to patient scenario. Those claims may require appeal. They require extra collection efforts on your part to obtain remuneration from the patient. Delays in your collections are going to extend your days sales outstanding, your DSOs, and Tom's going to cover the DSO portion pretty extensively. He's got some great information around that. Extended time in your accounts receivable, it correlates directly to the collectability of the services you provided. You know, in other words, the older it gets, the tougher it's going to be to collect, and that's going to drive up your bad debt. Combined together, inefficiency, poor collections, no strategy, it's going to damage your bottom line and put your business at risk. So, plenty of doom and gloom, right? What can you do about it? There is action that you can take. Practical solutions that are within your control that you can leverage. You know, it's important to remember, functional need is not based on the size of your lab. Any functional solutions you deploy should be scalable, whether you're a 50 requisition a day lab or a 10,000 rec a day lab. Your need isn't any different based upon your size. So first, the issue of missing billing information. This is an age-old problem that labs deal with, and it's not ever going to go away. So really, don't get your hopes up. But it doesn't mean that there aren't practical steps that you can take to mitigate the issue. I think first and foremost, one of the smart strategies that labs really need to deploy here is start measuring the volumes and the types of errors that you see. You need to set up some sort of a threshold. In fact, that's vital to this process. Set a gold standard for you. Let's say it's 5 to 10% of your claims, and push your efforts to stay at or below that threshold. You need to monitor this every day, or at least weekly, and identify who your greatest client offenders are and those types of errors that they're generating for you. Educate them. Work with them on reduction, but also what are the best ways for you to work with them to request and provide information when it is missing. You're going to find a lot of different responses when you engage your clients and you ask them what day of the week, what process is best, what works for you. You might also look at your contracts with your customers and put some more teeth into them. Now, in other words, if they fail to provide billing information, maybe they're on the hook for the bill, or their patients are for the full amount. Now, I know everybody's muted on the call, but a lot of times that gets a strong reaction because the immediate thing that I see from labs is, oh, we can't do that. We don't want to risk losing the customer. Well, at some point, you're at risk of losing your business if you're not collecting. Here's some steps to solve the problem. Know your clients. If you own them, you can mandate compliance. If the client's a hospital or a reference lab, an interface can minimize many of these issues further. It's not necessarily this mentality of a one-size-fits-all approach. You need to make use of technology where you can. For example, emailing, faxing, web portals, all of those are important solutions. But again, it comes back to that scalable technology and those solutions that are out there that automate this missing information request process as much as possible, as well as your client's fulfillment of it. But it's always important to keep in mind, even a good manual process is better than none at all. You should be rethinking checking your patient's benefits eligibility to affirm coverage and liability. Again, there are many solutions out there today that fit really easily into the lab's workflow. Whether you're checking at the time of accessioning or you're checking over in the revenue cycle portion of the process. There are things from batch or real-time checking to some more recent coverage detection solutions that are in the marketplace. The coverage detection solutions are really interesting. They're newer, but they don't just check the payer that you have. They check that patient over time for any coverage they've ever had. At the end of the day, the better equipped you are for assuring the right payer for the right dates of service, it begins right there to minimize any back-end claim work that's required. Labs that have a process in place that check on patient benefits eligibility save themselves the trouble of working unnecessary denials on the back end related to coverage. It reduces your time to client claim submission, which in turn reduces your time to payment. Knowing patient liability in advance is also another advantage here. It provides you an opportunity to engage the patient in advance of the patient ever getting a bill. I see many labs now using this opportunity to engage that patient early on if they feel that the bill from the laboratory is going to create a substantial liability for that patient. They offer them things like installment plans or prepayment options, along with other options that we'll talk about in more detail. It's also important to pivot from this old school mentality of get the claim out as quickly as possible and treat it like a lab result, and I'll just work things on the back end. Well, throwing bodies at the problems at your aged AR may be a reality that you're faced with, but it doesn't have to be that way. New thinking is really to drive your claim submission, drive your claim compliance, pre-claim submission with a strong rules engine that's going to catch these types of issues up front and allow correction before you send the claim out the door. Whether it's a medical necessity edit, a CCI edit, a flag that authorization was required for a CPT code before you submit it to the payer, or again, that bad insurance member ID, this type of upfront process positions your lab proactively for compliant claim submission the first time and every time thereafter. This feeds back into the process of obtaining missing billing information because you're catching these errors now upfront, working with your clients on a process that streamlines the collection of them, and it provides you then important metrics that you can use to measure and then drive down your error rates. The bigger picture here is visibility to what's happening, and then the processes you're putting in place to monitor and measure outcomes. You know, if you don't know your remittance trends, then you don't really know how you're getting paid. You don't know whether you're getting paid according to contract. You don't know whether you have denials that are due to submission errors or denials that require claim appeal efforts. If you're out of network, you know, this is an important thing to consider here because, again, I've worked with some labs that their preference is to stay out of network. They've determined that being out of network is not a barrier to reimbursement, but for your lab, it might be. You know, that common perception is that if I'm out of network, I'm going to struggle collecting on low pay or no pay claims. And, you know, that's not always true. Sometimes being out of network is okay because they are getting paid acceptably by the payer and they don't want to change that status. But the bottom line here is you have to know how you're getting paid, which means using the right tools to properly view and to properly analyze your trends. All right, Tom, you're up.
Okay, we're going to talk a little bit about assuming you do all the things right on the front end, how do you deal with claims on the back end? So if Kurt, you can go to the next slide. What we realize is that 80 to 90% of the claims usually get paid cleanly the first time on the back end. You have issues on the front end, but you also have issues on the back end. Effectively resolving the remaining 10 to 20% of claims means the difference between making and losing money and requires most of your AR effort. The chart below, you know, kind of shows different levels of performance for AR. There's two things I'm going to go over. One is days of sales outstanding, which is the most conventional metric. And you can see I have a chart here of different labs with different levels of performance. And gross AR is, the DSOs is basically gross out accounts receivable divided by your average billing. And the number can be skewed a lot by how quickly you move things to write off or transfer to bad debt. But in general, if people are billing correctly, A level of performance is around 45 days, B level is around 60, C is 75, and D is 90. And when we look at AR, you're not only looking at the work that's been billed but is sitting on the AR, but it's the work that's unbilled, work that's on edit, being addressed for some of the reasons that Kurt mentioned. You want it, that's your total AR, the unbilled work and the work outstanding on the AR. When I see a lab that comes to us and say, hey, my DSOs are 35 days, I don't automatically think they're doing a great job. They're too quickly writing off work off their AR probably. And so at the end of the day, you want to have a good number to accelerate cash flow here, but you'd rather have a higher DSO number, but realize more cash collections. So what you need to do is have a real strong line of sight on managing the AR. Did we skip a slide, Kurt? I'm thinking, no, okay, there's one, okay, I'm sorry, go ahead. I'll cover this next. When you're managing the AR, you want to make sure you have appropriate resources assigned to it. You want to make sure that, first of all, you've done a comprehensive review of all the claims that are being denied and what are the reasons. Have you automated all the rules as possible for adjudicating claims and making sure they can be worked effectively? In other words, you want the work on the AR that you have to work on to be the amount of claims that really need work. And as a general rule, we feel that you need 1 FTE to work the AR for every 1,000 claims that you process in a laboratory. In other words, 10% are going to hit the AR. A representative can work 100 claims. But in order to really validate how many people you need on the AR to go after that 10 to 20% of revenue, you want to look at the number of claims that you submit by your major financial classes. How many of them are not being paid on the first submission, to determine how many have to be worked and how many claims can be worked an hour for that financial class based on the type of tools you have, online tools, the way you can research claims quickly, to determine the total number of hours that are required to work the AR. One of the things that I find frustrating when I talk to clients is invariably they've either grossly understaffed this function. They don't have enough people on the back end because they haven't defined the workload that requires follow-up. Consequently, the days of sales outstanding grow to larger numbers than anyone would like. They don't execute on claims quick enough to collect timely, and it affects the overall financial performance of the laboratory. Next slide. When we manage the AR, one of the things we also want to look at is not only are we getting claims fully adjudicated, but are we getting them fully adjudicated in a timely manner? So this is a chart that shows that we look at what percentage of claims for a certain month have been fully adjudicated by a set time. This is probably looking at a 3-month period, and you can see that the number of claims that are fully adjudicated ranges from 70 to 95 or 96% based on the financial class that we're looking at. And obviously, if you have payers that pay, that have patient responsibility, and you can see from this chart that 20% of the claims have patient responsibility, or the amount is 20%, you've got to be very careful of working those claims timely so that if a patient has a balance, you're getting them the claim quickly. So obviously, DSOs is one indicator. Another indicator that we really need to look at is what percent of the claims are fully adjudicated. And finally, and looking at the adjudicated claims, what percentage of the revenue is collected on them. So you want to have good days of sales outstanding. You want to staff the AR function appropriately. You want to make sure claims are getting adjudicated according to the goals you've specified for each financial class. And you want to make sure on the adjudicated claims, you're collecting 90 to 95% of what's allowed. Okay, I'm going to talk a little bit about working with patient responsibility. And you can go to the next slide. One of the challenges we have in the industry is patient responsibility is more and more part of the lab situation. We have high deductible plans. Patients have larger balances to pay on lab bills than they've had historically. And labs need to understand how are they performing on patient responsibility. And I have a chart here that shows different labs with the same level of gross revenue and certain components of true self-pay and co-pay deductible payments and what their effective collection rate is. And by the traditional measure that people have historically looked at, we're always looking at patient bad debt as a percentage of gross charges, which is one of the most meaningless indicators you can look at. What you really want to focus on is what is my patient bad debt on my patient responsibility? And as you can see in this chart, the three labs have different levels of true self-pay, copay deductible, different performance. And by the standard metric, the lab here that has the worst performance, Lab C, with 5% of their bad debt on charges, really collects 77% of their patient responsibility, which is an outstanding number. And if you don't define this problem correctly so it's actionable, you can't deal with it. So it's very important that you have a strategy to focus on collecting patient balances, and you define what patient responsibility is. I've been in meetings with even publicly traded laboratories when I ask them what is their true bad debt on patient responsibility, they have to go figure it out because they're thinking of it the old-fashioned way. If you're not thinking about this problem correctly, you can't define it and you can't develop strategies to address it. Okay, Kurt, next. So what I've outlined here are some of the executional strategies that are important to work on to realize as much cash as possible. Obviously, if you're in a better demographic market, that helps, but clearly having great statements, and I don't take that lightly. When I was designing our first forms for billing, I spent as much time on that as I had designing lab reports for physicians. In other words, you want easy to read and consolidated statements in layman's terms that show a patient what they owe on the bill. That's incredibly important. Many of the statements you get from healthcare entities you can't even understand. And if you don't understand them, you just throw them in the wastebasket. In general, the patient billing cycle should not extend beyond 120 days. You should send out 3 clear and concise statements, and you want to stay current with patient posting and working bad addresses so people don't get bills after they paid. I visited laboratories that send out statements for 6 months, and that's just a waste of time and money. You should be able to track how many of my statements are paid on the first bill versus the second versus the third, and to what extent can I tweak my statements or change things that improve those numbers. You're constantly evaluating different tactics you take and how they impact the performance. Kurt spoke at length about eligibility checking. It's particularly important for uninsured patients. And obviously, to the extent you can get insurance information, you're better off than sending a patient a bill who hasn't told you what their insurance is and hoping they'll provide that information. It just takes longer. Obviously, having an online portal with flexible options for updating insurance information, paying by credit card, offering prompt pay discounts, creating an installment plan that's automated, facilitates the process of patients being comfortable with paying online or paying off balances in an easy-to-use format. Finally, dedicated customer service. Have dedicated people handling your billing inquiries who are comfortable with lab nomenclature and operations and are effective at discussing patient insurance coverage issues. This is a highly complex area. What is covered, what isn't, what is the patient responsibility? And if you're not articulate about explaining these issues to patients, they're less likely to pay because they don't understand. Finally, this is an area where all labs have to spend more time on, and tracking outcome, looking at the percentage of claims sent to collections, the average number of statements required to get a bill paid, how many phone calls come in, and the response rate. The better your process, the less your phone calls, because if you change your statements and they're easier to read, less patients are going to call. So those are some of the operational tactics that labs ought to excel at to execute on patient responsibility.
Tom, that's great stuff. Just to make an additional comment here, some of the trends that we're seeing labs start to move in is more of a soft collections approach also. So they're looking at software solutions now that can provide the ability to obtain authorization from patients. So the lab can be allowed to send them text messages, to email them, to allow them to pay via phone call. So there's some really interesting things going on, and technology continues to solve some of these problems and help labs with this entire landscape. So we're going to shift gears a little bit and let's talk about some of these reimbursement pressures here. So just like the issues list back on slide 6, the reimbursement pressures, again, should all hopefully be familiar to all our attendees today. You know, these are the primary issues that I hear labs talking about. It's PAMA rate reductions, it's their denial trends, it's low and non-payments, it's claims aging out without a response. You know, when it comes to some of the solutions here, it's important just first and foremost to realize that there are things you can do. You know, when it comes to PAMA, you know, one of your best options here is to get efficient. Exercise better control over your costs. Labs have a great track record of already doing this. You know, historically, they've done great jobs implementing lean processes or having Kaizen events that address things from sample collection through processing, testing to report. But a lot of times labs forget to shine that light on the back office and apply this exact same mindset to billing. When you take this approach and adopt this sort of philosophy, you realize that there are practical things you can do and allow you to automate and to do more with less staff and move away from the proverbial throwing a body at a problem. Tom mentioned this earlier too, maybe just in a different way, but monitoring and measuring. You know, you can only manage what you're measuring and what you're monitoring, and you need to do this with your revenue cycle so you know what's going on. When you build in a high degree of visibility to things like your AR, then you always know where the dollars are. You know where they are from an aging category, from a financial class, from a payer perspective. That allows you to then go after it in a timely manner. It lines the work up for you so you know where to point the fire hose, so to speak. You know, by establishing benchmarks, you can check the health of your entire process every day. And you've heard me say this a couple times, daily, daily, daily. I don't think that can be underestimated. It should be simple and easy for you to set those benchmarks and look at things on a regular basis. You know, when you do find yourself in the situation of having to appeal claims, this is an important thing to have an informed strategy about, and also to have good tools that not only classify your appeals, generating the right letters for that level of appeal, having the right analytics so you can monitor the status and continually refine your strategy. Those things ease your follow-up burden and drive your collection efforts in a positive manner. It also lets you know where your quick hits and your easy successes are with your appeals process versus those processes that ultimately may never result in a claim. So you can go after the low-hanging fruit. You can also cut your losses with an informed strategy. You know, it's really these harder to collect dollars that cause you to expend, you know, the greatest amount of effort. It doesn't have to be that way. You can streamline this portion of your process. You can really reap great rewards. Ultimately, you know, labs that adopt this mindset of continuous reengineering, continuous quality improvement, they are on this cycle constantly, and they're directing efforts that improve efficiency. And at the end of the day, that's one of the strongest things you can do to deal with decreasing reimbursement, is to get efficient. All right, you're going to hear me say it again. One thing successful labs have in common is they look at their analytics every day. They evaluate things like error rates. They look at utilization. They're looking at the productivity of their team, and they're diligently policing their accounts receivable. You know, these KPIs, or key performance indicators, and others enable them to keep their finger on the pulse of their revenue cycle, and it positions them to be proactive when they need to. You have to be able to identify trends. You have to then focus your work efforts towards those biggest returns. Don't risk being reactionary and making those kinds of decisions that result in throwing people at problems. You know, we touched on error rates earlier. So you really can't underestimate the impact of addressing these types of errors. You know, from whether they're pre-claim types of errors and you're setting that benchmark and developing your strategy around working these, especially when it comes to working with your customers or leveraging the right technology, or it's a post-claim type of error where you're evaluating root cause for the rejection and proactively taking corrective action. These things are first and foremost things you can do something about. And again, it's education, it's technology, it's foresight on your part to be putting benchmarks around these and really drilling down to what the issue is. You know, I included returned mail here as another big issue, and I've been hearing labs talk about this again quite a bit. It's with the increase of patient liability, it's really seen an even bigger spike. It's really critical to get statements to the right recipient in a timely manner. And Tom mentioned, you know, if there's a balance after insurance, it's important to adjudicate that claim quickly so you can get the bill to the patient quickly as well. So you need to monitor this also so you can either work with your clients to get the correct information, but another thing to keep in mind here is there's again a number of vendors in the market space that support checking and verification of patient addresses. They can provide you updated information electronically, allowing you to then get a corrected bill or a bill with the correct address out the door more quickly. Utilization statistics can get used in several different ways. You know, if your services are highly utilized by specific types of practices or within certain geographies, then this can be used to negotiate contracts with the payer mix covering those services in that geographic area. It also informs you or lets you know where you need to target client and provider education, because maybe there's actually an underutilization of some of your services that they just don't know that you have. And so those services also promote positive outcomes, and it allows you to inform your sales efforts and target those clients as well. Staff productivity is really critical. It's a huge area of importance. You know, you have to realize that the work your team is doing, it's quantifiable and it's measurable. You need to break down your revenue cycle workforce into discrete groups. Some examples I have are front-end cleanup work, customer service, cash posters, or the AR follow-up team. You know, just a few examples. Again, it goes back to setting standards and applying benchmarks here, measuring this, grading your employees. For example, when I was talking with Tom about this issue, they use a strategy of rating people from green, yellow, and red. Green is they're doing good, yellow needs improvement, red, immediate improvement required. But they have a strong metric because they really want to get everybody up into the green category. But when you get folks that are landing in the yellow and red groups, then you need to identify what training support do they need, how can you help them do better, and anybody then that doesn't move in the right direction after those corrective pieces are put in place, you can part ways with. Again, it comes back to making informed decisions. You know, I see a lot of labs now that are really incentivizing their teams with daily dashboards. I've walked into a lot of billing departments and there's a dashboard up on the wall, and there's monthly rewards that are going to the team when the team hits the mark. They're also using these measurements for individual performance measurements and rewarding bonuses based upon that. It's just important to make sure that you're doing all you can. It's also important to make sure you're providing clear, concise standard operating procedures so your team knows how to do the work that's in front of them. But again, it comes back to that mindset of that constant re-engineering and constant desire to automate routine tasks where possible. And Tom hit some of this already, but just to recap a little bit, you have to have a plan to actively manage your accounts receivable. DSOs are an effective measure. It measures that speed of collection, right? But you have to know what the dollar really represents. You know, if it's too low, that's not necessarily good. If it's too high, that's not necessarily good. You have to know what it is by financial class, by payer. You should make sure that nothing is aging out to the point where timely filing actually becomes an issue. There shouldn't be any claims that you don't have a window into. In other words, no hidden AR, no black holes. It amazes me when we're talking to labs that are on legacy platforms, older architecture, and I'll ask a question of, do you know where all your AR is? A lot of times I'll see people clam up. I get some slack-jawed look, some glassy eyes. Typically the answer is yes, and that's unacceptable. You need to know where your dollars are at all times so you can focus your efforts effectively. Another area, again, to focus your efforts is to collecting more from your patients as liability has shifted in their direction. Don't just settle for increased bad debt, and don't settle for increased write-offs. It's not a given that that's what you have to do. Know your market. Know how you're getting paid. Take advantage of diversification of your services when it makes sense. Monitor your denials and take some timely action against them. Again, if you're not taking action on your revenue cycle today, you're missing the big picture, and you're going to miss out altogether. All right, last time I say this, I promise. Labs should be looking at their cash flow every day. When you're contracted, make sure you're getting paid according to contract. Look at your actual cash against your expected reimbursement rates. This way, you can identify quickly and easily underpayments. That allows you then to take concise, clear action and work with your payer to remediate the issue. You should also be tracking non-responded claims. This is huge. Not only do you need to make sure that you have some sort of response, but ultimately, if you're not policing this, you're going to end up writing these dollars off. You have to have visibility to make sure that you are getting responses on your claims. And also, when you do get responses, any denials that you've received, and then looking at root cause to see what action you can take. I also look at non-contractual adjustments or other adjustments as simply missed opportunities. Now, sometimes there really is nothing you can do. However, you need to review them. You need to identify the areas where the other adjustments are being taken. And maybe some of them are very simple to correct. Maybe the claim wasn't submitted entirely correct up front. For example, I didn't send authorization when it was required. It was a non-covered service scenario. There were some compliance-related denials because I didn't have my rules engine configured correctly up front. Those types of things can result in other adjustments being taken. And if you're not watching that and you're not policing that, that's uncollected money on the table that you're not going after and you're not correcting long-term. Also, when you're in that situation of having to appeal claims, I mentioned this earlier, classifying your claims, having the right online tools, generating those right level letters for that level of appeal, and having solid analytics so you can measure your success of your strategy, it's going to ease your follow-up burden, and it's going to drive your collections effort in a positive manner. Now, the last thing I want to mention here, again, Tom and I both mentioned collecting from patients multiple times. There's a lot of strategies out there. Some of the things you should think about and you can do are maybe preemptively sending a letter to your patients as an introduction to your lab. It's a notification of they're going to get paid to patient. So send them a letter in advance, letting them know that you're going to get a check from your insurance. Please don't go shopping. Endorse and sign the check over to the laboratory because we will be sending you a bill. Other things to be thinking about here are offering and automating compliant discounting. Those things can incentivize patient collections. Things like installment agreements, allowing patients to pay what they can afford. Multiple payment options are also important. A note of caution here, and this is the compliance background within me. Anything that you do regarding discounting, make sure you're running by some legal counsel or a compliance officer, because different states have different regulations. Just because you think you can doesn't mean that you should. You need to be really careful here to make sure that you are following all legal processes and parameters to make sure that you're able to bill what you do. Surprise billing has obviously been in the news lately, so that should be top of mind for everybody. A few other things we're seeing labs do is allowing prepayment options now. So if I get contacted, I can make a payment up front. If I'm at a patient service center or I present at the lab, can I collect right there? So those are some of the tools that labs are starting to embrace to really address the cash flow and try to drive it in the right direction.
Okay, negotiating with payers. Let's assume you do everything right that Kurt has spoken to. You still have issues that you want to understand with your laboratory. And Kurt, if you go to the next slide, I'll explain what I'm talking about. Understanding the metrics of what your cost is per test, your revenue per test is important with all of your contracts. Kurt, can you give me the next slide? Oh, thank you. One of the things, we talked a lot about data and understanding things. One of the things everybody needs to understand is, what are my costs compared to my revenue? And when I talk to labs, a lot of them don't know what their fully loaded costs are compared to their contracts. And what I put together here is a hypothetical example of what I'm getting on a per CPT code and accession basis from each of the major financial classes, okay, for this hypothetical laboratory. And most labs don't have a clear line of sight on what payers or financial classes don't pay their fully loaded costs or come close to it. And you have to start by understanding, if I'm going to do a contract with provider X or insurance company Y, how does it work for me? Can I make money marginally? How does it impact my other contracts? And when I was running a laboratory, we would go into negotiations knowing exactly what we wanted with every payer. We knew what the CPT code volume was. We knew how many tests we had per accession. We knew how much of our cost was accession-based versus test-based, and we knew what we were asking for. And I think it's hard to negotiate with payers today, but if you don't even define the problem, and in this example I'm showing on the slide, it's clear that, and I don't mean to pick on United, but United historically has paid a percentage of Medicare, both above and below it, and at a certain point below it, nobody makes money. It doesn't even cover your costs. And you want to understand, if I'm going to be successful, and I've done everything I can to improve my revenue cycle, where do I have to go with the payers to improve my performance? And the first step is identifying what payers don't pay you what you need to get paid to service the business appropriately. On the next slide, I'm going to talk about a couple of the strategies, but clearly the payers view the lab principally as a commodity. And if you don't have leverage with them, it's difficult to move the needle. But even if you have leverage, you want to be able to make the case for what you want and use it with the payer. And a classic example of, I think, a healthcare organization that's been very effective in negotiating for the lab is Northwell in New York. Large health system. They have made lab a critical part of their strategy, and it's always on the forefront of their negotiation. And the payers need that health system more than they need Quest or LabCorp. And they've been able to negotiate reasonable rates, not outrageous, for their work because they've made lab part of their strategy. So I think, when you talk about what is the value proposition I can present, it starts with having leverage. Do the payers need you in some form or capacity? And obviously, being part of a broader organization that has contracts with payers and is critical to the payer's presence in the marketplace helps. But in addition to that, obviously you can get testimonials from physicians who are willing to speak to the payer on your behalf about the value of your service. But at the end of the day, it comes down to saying, what are the service factors that you possess that are unique and warrant getting paid your cost and hopefully enough money to be successful, either increased pricing or network status. Obviously, the most important one to have, if you have it, and not every lab has it, is proprietary testing. that can measurably impact healthcare outcomes. If you have that and you've been able to demonstrate the value and the payer needs the test, they've got to pay for it. A second point is convenient access for patients through patient service centers and locations and hours. I was helping one lab in Ohio that had 20 PSCs in the marketplace, and Quest had one. And they had a terrible contract with a major provider. You've got to go in and say, we're providing access and convenience, and you've got to pay for that. Obviously, if the laboratory is providing other services that the big labs don't in terms of phlebotomy services for homebound patients and nursing home patients, that's a value. You've got to be able to go in and talk about the things that make you different and warrant increased reimbursement. Another issue is being able to do stat testing, same-day testing because you're local in the marketplace. That's a value. Being able to integrate information to manage outcomes, to eliminate duplicative testing if you're a hospital-based laboratory is a value to the payers. You know, finally, execution is important, but people probably aren't going to pay for it on its own. You could have a great service, loyal physicians, very happy patients, but at the end of the day, the managed care plans aren't interested in paying more money unless they have to. You want to give them good reasons to do so, but they're not inclined to do it unless you put a gun to head. So I think what you need to do is first understand who I've got to work with to get better money. Do I have leverage I can bring to the party? And what are the service factors I can emphasize to increase the likelihood of getting a favorable outcome when I negotiate? So that's it.
Well, thanks very much, both Tom and Kurt. That was some excellent information. And now let me bring Nikki back in to remind everyone how they can ask questions, all our listeners. Nikki?
That's absolutely right. Great job, guys. So to the right of your screen, you see that floating panel, and just expand the questions section and type it right in, and we'll make sure that we call that out and address it accordingly. You have some questions that we've already received so far, Dennis?
Well, there's one question I know I've been getting a lot recently over the last year or so, and it has to do with pre-authorization requirements. Now, again, this typically, in at least many cases, is for higher end testing, you know, genetic and molecular testing, but not exclusively. So I just wondered, Kurt, are there any operational steps that you can identify that labs should be taking to speed up payments for those tests that do require pre-authorization? And then Tom, jump in after Kurt. Kurt?
Sure. Yeah. Thanks for the question. That's a hot topic. Absolutely. So, you know, you're seeing a lot of vendors out in the marketplace that provide prior authorization types of services. You're also seeing lab benefit management companies that are assisting with this. Operationally, from a lab's perspective, I think it's important for the revenue cycle, again, I know what CPT codes for what payers require authorization, and I do not want that claim going out the door until I know I have that information on it, or I have at least exhausted every effort possible to get it. I want to get paid the first time. I don't want that AR to sit there and extend my DSOs because of a lengthy appeals process, unless, of course, that's effective and I end up collecting on it. So I think it's important, number one, to have operationally strong rules engine, again, to prevent those claims from going out the door. But it's important that you're working with your customers and making it easy for them to provide. And we've all heard of, you know, software and agreements that are out there that kind of force this at the time of order within the provider's offices. I think those have some mixed results. At the end of the day, you're shifting an administrative burden over to a provider's office and asking them to do yet one more thing. And so I think it's a dicey situation. Ultimately, yes, it's their responsibility to collect it. Ultimately, it's the patient's responsibility to get it. But try to help them. Try to do the best you can to make it easy for them, and be very clear and concise that if you don't receive it, what are the ramifications? The patient's going to be on the hook, or they're going to get a client bill back. So that's my 2 cents.
Tom, how about you? What are you doing with your clients?
Dennis, I would just add that you want to know what clients are the offenders for what CPT codes and educate them as much as technology can help. A fact that a client understands that a test requires prior authorization and gets it before they draw the sample or send the patient to a patient service center is the easiest way to address the problem.
Great. Well, there's one other thing, and Tom, I wanted to throw this out to you, and then again, Nikki, I want to know if we have any, standby questions here. And that is, we've been discussing over and over again today. There really is a very harsh financial climate for the entire laboratory industry, both on the clinical and AP side. But given this this climate out there, Tom, in your estimation, because I know you deal with both independent and hospital laboratories, do hospital labs that traditionally have had a competitive advantage over independent labs, is that advantage still there, or is that basically receding because of what we're seeing out there today? What do you see?
I see it being retained. Okay, we look at their reimbursement on adjudicated claims. We see what's going on, and they have more favorable contracts because of the leverage they have in the marketplace. Now, do they use that always as effectively as they could? Maybe not, but they get paid well. And if you're working with a health system or a hospital that's dominant in a market and that the insurer needs to have them in their network for their employers, they have the ability to get paid differently. I don't see that going away, even though some of the insurers are trying to move the business. If the hospital talks to the payer and say, look, we have a deal and we want to be included on lab. We've negotiated a fair price. I don't want you trying to move work. We're trying to manage outcomes with all the clinical data. We're local. We have all this infrastructure. We need to have it supported. But you've got to be articulate and understand whether you're losing the business or what your attrition rate is on people going outside of your network to other labs, so you can identify it if it's a problem.
Great. Well, Nikki, do we have any questions from our listeners right now?
Sorry, got to unmute myself. Yeah, we've had a couple to come in. There's an attendee that's asking about any recommendations for a billing system that is meant for labs. Any insight or exposure that you guys have had?
That sounds like a totally loaded question. This is Kurt. That is what Telcor does. We provide a revenue cycle platform specific for labs. Tom offers billing solutions with his business, and Tom, I don't want to speak on your behalf, but they bill specifically for labs with the software that they're utilizing. So both your speakers today could talk to you offline about that more extensively if you'd like to reach out to us.
Right, and there are many different systems out there for laboratories. Certainly these are two of the best because that's why we invited them on, but there are numerous systems out there that you can certainly get information on. It's readily available.
Right, and the only thing, Dennis, I would add is that this is a unique enough area that using a general billing system like Epic or Cerner and trying to apply it to lab is challenging. And you're right, there are a lot of applications out there that are designed to deal with all the nuances of the space, but that alone won't get you to the promised land. You've got to buy something or lease something and then execute. I think a good system alone without the attention to detail from the management group is not going to get you the outcomes you want.
Very good.
Yeah, that's a good point. One more add-on to that. You mentioned other systems that aren't really geared for laboratory billing, and I think that's important to keep in mind. Tom had talked about what a bill looks like during the presentation, and a lot of those systems aren't really geared to generate a laboratory bill, whether that's a patient statement or a client invoice, and they can't control pricing correctly. They can't do a lot of the things that a lab needs to be nimble with and their responses to be able to deal with.
Great.
Hey,
Nikki, anything else?
This is John David. Could I step in with a question?
Sure.
My question is to Tom and Kurt. If you look specifically at billed amounts owed by patients specifically, what's a good goal for a percentage bad debt write-off for copays and deductibles amounts that are billed when you look specifically at the patient side of things? I mean, is it 10%? Is it 5%?
No, that's a great question. Kurt, I'll take a pass at it first and then you can chime in. Our best I've seen is collecting 80 cents on the dollar, maybe 83, 84. You are going to have people who figure out you're not going to go after them that hard to pay. But I see ranges, John David, as low as 50 on patient responsibility. And again, it depends on the client's mix of clients and how many patients they have with high deductible plans and aren't in affluent areas. But it's a great thing to track and work on. But I've seen 50 to about 84% on copay deductible.
Kurt, how about you?
Tom, Tom nailed it. That's really what we see as well. Granted, customers are trying to set that bar lower because it's unrealized collections when you're just having to send out the bad debt or write it off. So anything they can do in that department, whether it's some of the new thinking out there for soft collections and engaging that patient earlier, anything they can do to drive that up into that 80 cents on the dollar, 90 cents on the dollar is optimal.
And then just to follow up, and this was actually emailed by a listener. Again, looking at patient owed amounts, at what point do you give up and send the balance to a collection agency? In terms of either the length of time or the number of billing statements that you send out. At what point is it time to give up and hand it over to a collection agency?
I think the standard, John David, of practice is about 120 days, 3 statements and a collection letter warning. I think if you look at your yield, that probably makes the most sense. Kurt, what do you think?
Yeah, I agree. We're seeing some labs that are actually even going to a 60-day mark. It's really important, I think, from the patient's perspective that if you do get a bill, you're at least responding to it in some way, shape, or form. So if I'm the laboratory and a patient hasn't paid their bill, but I reach out to you and I offer to make a small payment, put me on an installment plan, anything I can do to show that I'm willing to try to reconcile the balance can delay that being triggered to bad debt. But if I don't respond, what Tom said is what we really see labs do. It's that 60-day, it's that 120-day. If you don't respond to me and you don't pay, we're sending you to bad debt.
Great. This is a little off topic, but not really, given what's been in the news recently, and that's certainly third-party breaches of some of our nation's, largest laboratories. Quest, LabCorp, BioReference had major breaches, and again, this is with an outside vendor. And given the fact that actually both Tom and Kurt, both of you are essentially outside vendors, is there anything that you would recommend that laboratories should be doing with their outside vendors to help protect patient information? Kurt, or why don't we start out with Kurt? Anything that you would suggest?
Yeah, well, that's a great question, because in light of the recent the breaches that have been in the news, we did have some of our customers reach out to us and say, hey, we're concerned about this. What are you guys doing? And we have an internal process where we're doing SOC audits. And that typically meets most compliance standards, even for hospitals. There are other things out there like high tech, high trust that show that you're taking all of the security seriously, and you can prove that you're doing it. So that's, as a vendor, that's one of the things that we're ready to provide, is that sort of information to our customers when they request it. It's important.
Tom?
Yeah, I would agree with what Kurt said. I guess, with your larger organizations, they already are going to demand a certain amount of security. With your smaller clients, they're a little more cavalier, and you've got to almost lead them. But with the big health systems, they're going to make you go through all of the scrutiny and all the certification that's required to safeguard their information. It's with the smaller labs that you've got to be more aggressive about saying what you will do and won't do in terms of transferring information.
Excellent. Well, this is an issue that's certainly out there, and we wanted to at least, give it a quick check. Nikki, are there any other questions coming in from our listeners right now?
Yeah, actually, a couple more have come in. One was towards the beginning. Jessica was wondering about a mention around the anthem policy. You guys briefly touched on that at the beginning of the presentation. She was wondering if you could circle back. I'm not sure if you
Yeah, by the
remember.
way, that's Anthem Blue Cross Blue Shield's rate alignment strategy that, again, is affecting certain states that was announced recently. And Tom or Kurt, I don't know if you can jump in with any of your insight in that area. Tom?
I'm not seeing it with any of our clients. And again, everybody we work with has enough leverage to have contracts that aren't being impacted by it at this point.
What are you saying, Kurt?
So, yeah, so this is an issue that a California customer of ours came to us and said, "Hey, what do you guys know about this?" And we did a little bit of digging too, and like you said, it's a number of states. I want to say it's between 6 and 10. That rate alignment strategy that's trying to equalize those reimbursement rates for lab and pathology services. I don't know that you're going to stop it, and I don't see any other plans or carriers doing it yet. But if Anthem does this and it rolls through and there's no reversal of it at any point in time, I can't imagine that other payers aren't going to follow suit. So yeah, we are seeing a few labs impacted by it, ones that are customers of ours in those states. And they're struggling with anything to do to respond to be able to have it changed.
And by the way, the states that at least we've heard of so far, and you mentioned California, but also Indiana, Ohio, Wisconsin, and I believe Missouri were the states that I've heard about. John David, I don't know if you can add more.
Yeah, there have been a few other states, and it's just sort of right now in the process. So that might be why it's just sort of becoming known, and Anthem has just begun over the past few months to send out letters warning their contracted providers of these rate changes. And a lot of times they're not specifying exactly what the new rates will be. So it's still sort of early, but there's at least, I think there's at least a dozen or so states, and those include all of the Blue Cross Blue Shield plans affiliated with Anthem. And then I've also heard that there are some non-Anthem Blue Cross Blue Shield plans sort of tagging along or following the lead of Anthem. So it's kind of early, but it's definitely happening.
Great. Nikki, anything else from our listeners?
So with the exception of a couple who were interested in your contact information, which I've already provided that, sounds like there's some services that they could really leverage at this point. There's another question, a topical question that came in, and it reads, how does a small lab compete with lab giants regarding technology? Besides outstanding customer service, what can we offer that sets us apart?
Kurt, you want to jump into that?
Yeah, sure. So Tom actually mentioned some of this in the presentation. He was talking about, the value add that labs can provide. But, when it comes to technology, it's typically scalable. And so it doesn't necessarily matter. I think I said that the functional use isn't driven by size, right? So if I'm going to leverage a piece of software or some other tool to navigate some process within my laboratory billing operations, that same piece of software shouldn't matter if I'm 50 recs a day or 10,000 recs a day. It should be scalable, and pricing should be scalable along those lines also, whether it's based upon utilization or transaction driven. There are a lot of solutions that are out there. I think about the things that I mentioned, like benefits eligibility and coverage detection. All of those types of solutions, yes, there is some nominal upfront cost, but longer term, small labs can leverage those solutions just like a big lab can do. And honestly, it's advantageous to small labs to really do that because they're the ones that are usually struggling for resources to perform billing operations. And if they want to do it on their own, leveraging tools that automate that, you have to have those. You just do.
Tom, anything to add?
Well, I don't know if the question was more about competing in general or just competing on revenue cycle, but I would say this, that service still matters and execution matters, and whether you're small or large, you've got to execute. And I think one of the challenges for the big labs is they build very efficient systems and cost structures, but they haven't been able to scale service. And that's why there's a lot of other people in the business still.
Great. We did mention out-of-network labs and that some labs are still seeing reimbursement okay in that area. But with the exception of proprietary testing, Tom and Kurt, are you seeing payers starting to initiate more hardball tactics in dealing with out-of-network labs? And is this going to be a trend we're going to see more of? Kurt, and then Tom.
So I don't know that I'd call them hardball tactics necessarily. Payers may not respond. So again, it comes back to some of the things we were talking about in the presentation. You need to make sure you're monitoring what you've submitted. You need to understand your appeals process, the paid-to-patient scenarios. We're seeing requests for more documentation and some frequency limitations that get levied out there. But as far as anything, more strong-arm tactic than that, not necessarily, not that we've seen.
Tom, how about you?
Yeah, the only thing I would add, I have seen lower reimbursement over the last year. In other words, they're paying, but they're not paying as well as they did. I've seen that with some of the commercial payers for the out-of-network providers.
John David, any last comments before we close it down?
I have more of a question rather than a comment, and that question would be, Tom, you had mentioned, and I know Kurt, in previous webinars you've mentioned this as well, that it's important to have easy to read billing statements that go to patients, and I'm just wondering if each of you have any specific examples. So we know that these billing statements to patients need to be easy to understand, but what are some very specific wording or mistakes that you've seen when some labs have make their bills to patients?
First of all, I think what labs traditionally haven't done is consolidate statements. So if you have 3 outstanding balances with a large lab, you get 3 separate statements rather than one that encompasses all the information. I think it's really important that you explain the contractual allowances and other adjustments in layman's terms so they understand how the bill works. The charge was $100. Insurance says we're only liable for
Tom, are you there? I think we lost Tom on that last question. Kurt, do you want to jump in?
Sure. So Tom was hitting it right on the head. Send me a bill that I can understand. Clear and concise language on that. I want to know what my responsibility is, why it's my responsibility, what did my payer pay, but then also what are my terms. I want to know how I can pay you, And I don't want a bunch of legalese on the document. Just give it to me straight, keep it simple, and don't busy up your statement with a lot of unnecessary things. I get some statements sometimes. I've got 3 kids, and they see the doctor for various things, and I can't make heads or sense of some of those statements when I look at them. And I end up calling the billing service on the phone, asking them to explain them to me. And I come from a lab world, so I shouldn't be confused by that stuff. So Tom was right when he was saying clear, concise, easy to read. Let me know what the payer's paid. That's really the simple stuff that needs to be on there.
And very simple English. It's got to be a word that people can understand down to a very low grade level.
Yes, layman's term.
Great. Well, ladies and gentlemen, our time is just about up. But first of all, I want to thank both Tom Hirsch and Kurt Mathis really for doing an outstanding job and sharing with us their expertise and their insights on critical billing and payment issues that are impacting labs of every size as well as AP groups. Now, on behalf of Laboratory Economics and all of my colleagues, I want to thank you for participating in today's webinar, and we wish each of you a very successful rest of the year and look forward to having you join us again in the future. Have a great day.